Hello! So I'm back to tell you about my latest jaw surgery stuff. I've got a new computer, so it's taken me an awful lot of time to set everything up in its new place. It's like a big TV, it's a 37-inch telly, so it's really exciting. Anyway, so what's been happening? About a month ago, I had lots of impressions taken, and it was really funny. They put this big slab of wax in my mouth, like a little kind of, a little thin slab with a piece of metal threaded through it, with a big piece of, a big kind of metal pulley type thing sticking out forward, and then they attached all of this measuring implementation stuff on the front, and they put a little X there and lots of X's on my jaw, and they measured all the distances between everything. And I was just really hoping that there wouldn't be an earthquake, because if I fell over off the chair and this big rod was sticking into my eye, anyway, that wouldn't have been good. It didn't happen. Phew. Not many earthquakes in Devon. Okay, then they sent me off to the photo lab, and they took lots of photos of my face. Did that happen last time? Can't remember. Might have happened a while ago. Anyway, they took pictures of each side view and the inside. Ooh, it's horrible. And then they pieced it all together. They kind of chopped it into triangles, so they kind of moved everything up a little bit and around. So it basically looked like someone had got a big hammer and hit like the bottom of my jaw, and it had just gone up a little bit into my face, which is lovely. And I moved forward a bit, which is what's going to happen, obviously, because they're removing that bit there. They explained everything that was going to happen again. They're very thorough, they're very good people. However, then I went home and waited, and I went in for an appointment just to, because my wire had moved and it was poking into my cheek, which is lovely. I went in, and this doctor said, "I don't understand why you don't know when you're going to have your surgery." And I happily replied, "Me neither, can you tell me?" And so she went off to the secretary, my doctor's secretary, and came back sort of with her tail between her legs and said, I can't tell you when it's going to be, you see, because we've had quite a severe influx of cancer patients, and your surgeon only works 1 day a week, so he can only it's caused quite a backlog. So I said to myself, wow, I'm really annoyed, but I can't be, you know, they have far greater needs than me, so I can't be annoyed, but they're going to give me 2 weeks notice, so I can do some temping. And things, and then that was it, really. I came home and organised a camping holiday. There's nothing really much else to report. They have been really good though, and seeing the picture of me afterwards is really helpful. Although I told my friend who had the same surgery when she was quite young that they did that, and she was shocked, because she thought that would be kind of detrimental in the way that it would give me false expectations, and it might not look like that afterwards. But it was such a funny picture, you know, it's sort of like a puzzle. They've just chopped it up and moved it around a bit, and I've done that myself on paint, so, you know, I don't think I'll be that freaked out by the whole thing. But yeah, so that's my news. Otherwise, my news, I graduated, which is really fun, and and there's nothing else really. I moved home permanently, which is why I'm in this lovely room. But yeah, and someone asked me last time whether you had to be over 18 to get it free on the NHS, and I assume that because it is surgery that is necessary rather than cosmetic, because it's all about your bite and making it easier for you to eat, and stopping teeth-related problems in the future, and also stopping nasal-related problems in the future. They told me they're going to have to trim my septum, which freaks me out quite a lot. Anyway, yes, I assume that because of that, the fact that it's necessary, it doesn't matter how old you are, the NHS is always going to do what it thinks is necessary. The NHS is great, apart from the whole waiting thing. But it's free, so I can't complain. Anyway, okay, too long now. Have a lovely day. and I'll talk to you in September-ish, which is when I'm having it done, I hope.